Okay, so I'm Travis from KDT Systems Technique, and we're going to go over the passive tensioning orthopedic reactive spring on the table, otherwise known as our compression spring, that is fully adjustable from 0 to 50 pounds of tension. And it's the only table in the manufacturing world of this kind that provides this spring, and it's very, very important to patient satisfaction and outcomes of effectiveness. So a lot of other tables either don't have a spring at all, so the tables open up so far to where the point where the spinous process is not even close to where the mechanism of action is, where the split of the table is. And that's what's nice about our Neural Flex design is no matter if you're 7 foot tall or 4'8", your spinous process is always in the mechanism of action for extension positioning, flexion positioning, and most importantly, the action of the distraction. So a spring will control how much the table opens and closes, and it actually facilitates against patient movement during the treatment. So when the ropes connect to the belt around the pelvis, it's distracting the lower part of the body, or the upper part of the body is fixated. So if we're not seeing any movement here during treatment, nothing is happening as far as results. So you want to see from the manufacturer, when this front caudal section is flat, you have about 1 inch of separation between the two cushions here. You want to see anywhere from 1/4 of an inch to 1 inch of distraction. So you don't want to see any more separation than about 2 inches from there, okay? So what the spring allows, the adjustable spring down here allows is controllable sense and nature of the table. So the table is not unwieldy. So you won't get that sensation of the table where it's ever going to open up to 1 foot or 5 inches. So no matter how hard you pull the spine with your force, you're only going to distract the spinous process millimeters, not centimeters or inches. So it's important that we keep everything tight and precise right in the mechanism of action here. So if you don't see the table opening during treatment, it's one of the very first things you check. The patient is positioned and belted up. Your staff unlocks the table section. As soon as the doctor hits start, the force will go to the lumbar belt and the table will open up just ever so slightly, and then you're going to ask the patient if they felt that. And if they don't feel that, and maybe you didn't visually see that, you want to come right to the compression spring and you want to loosen it to the left. Each full revolution is 2 pounds. So how I do it to make it easy, I'll loosen it 5 or 6 turns. So essentially 5 turns would be 10 pounds. So you're making the patient feel that something is happening, and you're also allowing the table to be effective by opening. So even if the spring is completely loose, which means all of the threads are on the outside of the table frame, the table still won't open up too much. So after about 1/2 inch or 1 inch, you'll start to react to the spring tension. So it's progressive reactive, like the forks on a motocross bike. When a rider hits a jump, when they land, it reacts to that downward pressure. This compression spring reacts to patient movement. So if it's opening up too much, the clinician can tighten it up a little bit. If it's not moving at all, you can loosen it to make sure you're getting that effect, and you're increasing the perception to the patient that they're really getting a good feeling of the distraction. So the spring tension down here, if you tighten it to the right, that will tighten it. If you go to the left, that'll loosen it. So you want to keep the spring tension about halfway tight, which means you're going to have about 25 pounds of tension. Half of the threads are on the inside of the table frame and half are on the outside. So that's a great starting point that works for most patients, and then you can either tighten it or loosen it from that position. One more added thing of discussion here is that the compression spring also has a very important aspect to it, to where we're not only just unloading the spine to create decompression therapy, we're actually help facilitating compress the spine back together and pump it like a sponge in a bucket of water, where you're pulling in good water and you're getting rid of the dirty water. So in the spinous process, the osmosis, so when the rope pulls the belt and you create distraction, the table goes with it. So it opens up and you're imbibing fluid through the end plate. After the timer's done on the protocol, it's going to release and go to its rest phase. And the table is actually going to facilitate the rest, and it's actually going to compress the discs back together ever so gently, and then it's going to distract back open and back shut. So most other tables you'll see don't have this feature, and the table is just going to remain open during the rest phase. So you're not being as effective compressing while you're decompressing.